You're welcome to our channel. Thank you for following. If you haven't followed us, please follow us. If you haven't subscribed, please subscribe. A while ago, we looked at the different types of pelvic scans where we discussed the transabdominal and the transvaginal scan. So today we are going to look at who is supposed to do a pelvic scan. And we shall specifically look at the transvaginal scan. Who's supposed to do a transvaginal scan? As a little recap, we said the transvaginal scan goes via the vagina and then we scan. So who's supposed to do a transvaginal scan? Ideally, all non-pregnant pelvic scans are supposed to be transvaginal scans. Non-pelvic, non-pregnant pelvic scans are supposed to be transvaginal scans. However, in Uganda, we still do transabdominal pelvic scans where we should have been doing transvaginal scans. So we're supposed to do a transvaginal scan. Number one, women with chronic pelvic pain that have maybe done the transabdominal scan and it turns out to be normal, but they still have complaints of pelvic pain. You are advised to do a transvaginal scan as well to be sure that everything is okay or to see what the problem could be. The other type of people that are supposed to do a transvaginal pelvic scan are women who are having regular sex. Regular sex, according to science, is at least 3 days of intercourse in a week or even more, but at least 3 days of intercourse. If you're having intercourse with your partner for at least 3 days in a week, but you find it hard to conceive over a year, then we shall say you're battling infertility. So you also advised to do a transvaginal pelvic scan to check on the reproductive system, to check on your uterus, to check on your ovaries, to check if the eggs are growing normally, and also to look critically and see if there are any masses in the pelvis that could hinder you from getting pregnant. Then who is also the other category of people that should be doing transvaginal scans. If we do a transabdominal, this scan that we do here, and we look at your system, maybe you see masses that would not categorize very well or we do not have very good diagnostic information, we can recommend to do a transvaginal scan to assess the masses clearly, because the transvaginal will give us a better view of the masses. So we can do the transabdominal pelvic scan, and later on, according to how things turn out, you're advised to do a transvaginal scan as well. The other category of people that are supposed to be doing a transvaginal scan, for example, if you've had a miscarriage and it is maybe hard for your sonographer to differentiate or to know if you still have retained product of conception or the abortion is complete or the miscarriage is complete, you're also advised to do a transvaginal scan. But sometimes we do a transvaginal scan in pregnant mothers, especially if we cannot locate the pregnancy on this normal scan. If you can't see your pregnancy on this normal scan, we shall advise you to do a transvaginal scan so that we locate the pregnancy clearly. Also, if we suspect you have an ectopic pregnancy and things are not coming out clearly on transabdominal scan or the usual scan, we shall do a transvaginal scan. There are so many other cases where we are supposed to be doing a transvaginal scan, and we shall see them maybe in our next episode. Thank you for following. Please keep here for more information. Switching off.